We are an agency that is a nonprofit agency that works with families alongside them. So it's very non-threatening, and we work to provide them with therapies, all types of therapies, occupational therapy, physiotherapy, speech and language. We support children that are working in daycares or preschool. Basically, any child from 0 to 19 that has any sort of problems or concerns, behavior, physical, we would have that child come and see us, and we would try to work with them and see how we can support and help them.
A family-centered philosophy, which is really what our center is based on, really comes from the idea that the child and their family are central to the whole process, and we are just really sort of satellites around that, and that our work needs to focus on their culture, their wants, their needs, and all those sorts of things for their child.
They provide me with skills that I can use at home, things that I wouldn't think to even use. So I can order from here. They send me home with therapy tools. They come to appointments with me, to other people in the community. They really have my back.
Discuss with them, what are you concerned about? What's going on for you? Tell us a bit about your child. What kind of things are they good at? What kind of things do you love about them? And what kind of things are frustrating for you right now?
We have parents look at their child and they identify when, where, their best guess of why, and their best description of what happened. And then we analyze that data to figure out really what's going on.
When I see children run into the center and run to the therapy room and say hello to one of my staff, and my staff say hello back to them, and you can just see that connection.
Play is it for children. You know, play is how they learn things. Play is how they interact with others. It's how they figure out what's going on in their world, and how they have fun and relax and find joy in the world.
So we use play to sort of achieve our ends, the activities that we need children to do, and the movements that we need them to practice.
Play is so important, going outside, and just as adults, we need that variety of experiences to have a rounded life.
And then you see the family sort of going, hi, you know, and there's an interaction of, well, how's it been going? And, you know, and the mom's talking or the dad's talking and our staff are talking and the child is excited. That, to me, is what it's all about. Because then you know there's going to be a great little connection, and you know there's going to be some work done.
So seeing them progress and seeing them excel reassures me that I'm doing a good job, and reassures the families that they picked the right place. And the outcome is the best outcome, right? The kids have quality of life. They're doing things that other people said they will never do.
I think every interaction that I've had in the past 7 years with these families and children have been rewarding. And to just pick one situation, I'm not sure I could, because sometimes it can be the simplest thing, and the change that you can make for a family or a parent, that can be rewarding. And we make that child's life easier. And we try to make that child's life quality for what they want.
They all can change. I've worked with lots and lots of kids with very extremely challenging behaviors, and they all changed. They all changed for the better.
It's amazing, because if I didn't have these supports here, I would have to travel, either Kelowna. I already have to travel to Vancouver a lot anyway, so just to have this here is really beneficial, especially for my family.
And if we can make a difference so that that child looks back and thinks, you know, that person cared about me and my well-being, and it didn't matter that I couldn't run the same as someone else, or I couldn't do something the same as my friend. I'm just as special as that person. That's our goal.